Ida Met-Aris from Healing Circle Community Acupuncture. In this video, I'm going to share with you some sample of the expanded female hormone panel reports that I've done on some of my patients and how I have helped them in their fertility journey. So let's get started. Let's first take a look at this graph of a textbook case of a woman with a perfect follicular phase, perfect time where she ovulates, and the perfect time of where her luteal phase will start. And trust me, in my 15th year of practice, I do not see this nice curve at all. So the first 14 days or so, if you're on a 30-day menstrual cycle, is known as your follicular phase. And then once you ovulate, the middle part of that graph shows your ovulation, where there's a peak in your luteinizing hormone, or your indicated as LH on that graph. And how once you kind of like pass the follicular phase into the luteal phase, how your progesterone level is slowly going up and becoming a bell curve during your luteal phase. And if you had continued being pregnant, that progesterone curve would continue going up. However, based on this classic textbook case graph, it goes down partly because that's when your menses come. Alright, so now let's take a look at some of the sample report of my patient. As you can tell on all those graphs that you see, they are nowhere near the classic textbook graph, and this is quite common, and that's where I come in terms of trying to understand what's going on with your hormone and trying to see how else I could help you. Alright, in some of these graphs that you see, you can see that none of them are having the perfect bell curve. Some of them are having the indication where the progesterone and the estrogen curve are cutting it too close. And then some of them are even going through phases where the progesterone and estrogen didn't dip down to indicate that the patient is getting a period. In particular, this last one. Okay, so let's look at some of these patients. When you do these tests, what is very important is that it will tell me what are the output of your estrogen and progesterone levels every time you do your spit. So if you look at the first table that indicates days of cycle, estradiol output, progesterone output, it will also indicate me your cycle information, meaning that when you are doing this spit test, how many days was your menstrual length for that time when you do the test. So on some patient, it indicated that it was a 29-day cycle, and others was a little bit shorter, 24, and then some, a little bit longer, like 38. So what it does is that just by looking at this table, I could then roughly know when you ovulate. For example, for this first patient, female 36-year-old, she ovulated in between day 12 to day 14. How I know that is because at that time on day 12, her progesterone output was 14. And then at day 14, her progesterone output was at 57. So we are kind of like looking at the spike of when the progesterone numbers did a very big jump. So, for example, some women will, I don't know when I ovulate, so I don't know when I should have sex, that kind of stuff. So by knowing this, you could then plan when you would want to have sexual intercourse. So for her, what would be great is that if she would have intercourse at day 12, perhaps 13, up to day 15. And then, so hence and so forth. So what happened is that once we look at that table, the corresponding graph is actually a visual representation of all the numbers that is correspond to these patient's spit test. So some people are more visual, some people like looking at numbers. So by looking at the her graph, some parts of her graph are not looking as nice as the classic textbook graph. And that's not uncommon. This lady, this patient of mine, she actually had a cycle length of 29 days, which is really nice. It's not a super short cycle and it's not a terribly long cycle. However, what I want to indicate also as part of the benefit of doing these tests, apart from knowing the estrogen and progesterone level, is that at the bottom of that page, you would see her DHEA level and also her testosterone level. While her DHEA level is normal, the range is 3 to 10 and she scores at 5, which is a very good number. Her testosterone level is a little bit elevated. If you look at the reference values, the normal level should be between 10 to 38. However, she scores 44 when she did this test. So this kind of like give me an indication maybe there's a history of PCOS that was undiagnosed, or maybe it warrants us to investigate further. Perhaps she has a little bit of endometriosis, so hence and so forth. Do bear in mind that men and women do need estrogen, progesterone, and testosterone. Obviously, for us gals, you don't want to have too high of a testosterone because clearly, if you want to get pregnant, what you need is good progesterone. And partly because progesterone is really the hormones for gestation, as the name suggests, to help you increase your chances of getting pregnant. Okay, so as we move along on some of the other case, this is a case of a female patient, age 33. She is trying for a third baby. She has 2 older children at that time. And there was a 10-year gap before she got pregnant again back when she did the test a few years ago. Her pre-existing condition was that there was no obvious ovulation. She was on IUD for a good 10 years and her cycles are always very shortened. I was very curious as to what her numbers are because as you use any form of IUD or birth control pill, I really want to know, and especially if you have been using it for a good period of 10 years, I really want to know how these affect your hormone levels. So let's look at her first graph. It shows that she has a shortened cycle of 24 days, which is kind of like not ideal. I think in order to increase the chances of getting pregnant, if a woman can have a cycle between 28 and 34 days, in my opinion, that is the sweet spot, okay? And then let's look at her graph. Her graph is like crossing at the wrong places, and then doesn't cross over at the right places, that kind of stuff. But again, this is also a case of a patient with an elevated testosterone level. If you look at the bottom of a chart of her report, she was registering 58, which is a little bit higher than the previous patient. And bear in mind, this is a mom trying to have a third baby. Nonetheless, she did get pregnant like 2 or 3 months after we do this test and after putting her on a set of herbs and supplement to balance her hormone. She did not have a history of endometriosis or PCOS. So in my opinion, the only thing that was amiss for her was that her output for her estrogen and progesterone was a little bit on the low side and too much of a testosterone. So once we balanced that, we were able to balance her endocrine system. And then I think that really helped her to get pregnant naturally without using IVF. And she was really happy about that. Okay, so the third patient, just to give a little bit of a difference, is that this is a female patient, 34-year-old, no obvious ovulation all the time, and history of miscarriages, and also having a long cycle, meaning that she would have a period 1 month and no period 2 months, 3 months, things like that. So what I'm basically trying to help her with is to make sure that we know what her numbers are and to see if we could establish a cycle for her and also to shorten her irregular menstruation. Partly because it's really hard to know when you're ovulating if you're just having period once every 60 days or 90 days. So when she did this speed test, Her cycle length was 38 days. Her progesterone level, if you look from day 16 to day 33, are really on the low side. She was registering 16 on day 16, 18 on day 18. She was also spitting out 16, day 20, 33, day 23, she was spitting 12, day 28, she was spitting 21, and then day 33, she was spitting 47. So that's a little bit too low for progesterone, especially past ovulation. When she did the spit test, there was no obvious ovulation for her, so that was also another cause of concern for us to further investigate if she does have a history of PCOS or endometriosis. Her DHEA level at the bottom of her report on that same page is quite good. She was registering at 6. However, take a look again at her testosterone level at 50. And then if you look at her graph, the picture of it, her estrogen level kind of like plateau at the very beginning all the way up to day 14, and then it had a little bit of a spike, and then it went down, and then it kind of like spiked again towards the very end. Her progesterone level was really interesting. It started off at 51, and then for some reason it spiked up to 110. When if you look at the classic textbook case of the progesterone and how it should behave at the follicular phase, it should be just be going on low and then go up after ovulation. So something is going on with endocrine and not communicating and not giving the signal to release a hormone properly. So we continue working with her. And then, we obviously we're going to try to help all these patients to get pregnant. So for cases like this, when the testosterone level is way higher than the estrogen and progesterone, the first thing I would do is to ask the patient to do a detoxification program or a purification program. The reason being is simple. As women, we shouldn't have too much testosterone. And if you want to get pregnant, you need to bump up your progesterone numbers. And all of these patients, you do see that the progesterone level are not at where it needs to be, or they fall short even within the reference ranges. So that would be the first test. And all these are good baseline numbers, because on some of these patients, if they don't get pregnant within 6 months of intervention and all those, I would ask them to redo the test just to see if the numbers move. If the numbers move, it means that what we are doing for them is working out. It's just that maybe there needs to be a little bit of patience in terms of, having a successful conception and things like that. Okay, so the other thing that I love about doing this test is that it will also tell me the follicle stimulating hormones level and the luteinizing hormones level. So this is all these pages. Okay, all right. So when you look on the left hand side where it says FSH and E2 search analysis, what we want to look at is that towards the very end of that table, let's say at day number 23, I am interested to look at an FSH level that is closer to number 60. So on some of these patients, they are registering at 137, and then some are registering at 23, and one patient actually registered at less than 12. So that just shows to me that the hormone that needs to oppose the estradiol hormones are not working properly. So it's also an indication to me if it's just a issue with the endocrine. It's kind of like easy for me to help, because what we need to do is to balance it. There's really nothing wrong. We just need to balance it and kind of like prod the body and make sure that the body has enough nutrients and enough good food to make sure that the hormones will balance each other out. And on the right hand side, you will see the LH and the PI search analysis. PI means the progesterone. So if you look at the very first box of the table, let's say around cycle day number 7, and then the LH number for this patient was at 31. that's kind of good because I do want the number to be close to 30, and 31 is close to 30. Whereas on one other patient, it says here that at cycle number 8, she only spit out, her luteinizing hormone was registering at 8. So 8 is kind of a bit too far from 30, so we need to improve that. And then on another patient at day 7 of a spit, her luteinizing hormone was at 15. So she's kind of like halfway through that 30. But all in all, when I look at the luteinizing hormones level, when it is being placed against the progesterone level on that table, at one glance, on all of these patients that you're looking at, none of them are none of the numbers here are above 200. When none of the numbers here are above 200, it just tells me that during that menstrual cycle, when they did this spit test, there was no good luteinizing hormone surge. What I mean by that is this. We need to have this good surge. And what is indicative of a good surge is when, based on your spit, at least one of those numbers should be above 200. And it should be at least day 15 onwards, towards the end of your cycle, because that is the luteinizing hormone cycle stage. So as you can tell, a lot can be told from these few pages of results from these patients of mine, and I hope this gives you an indication as to how the female hormone panel saliva test kit could help you. Firstly, it's very valuable information for me to help you. It establishes baseline. It establishes things that what is amiss in your hormone balance, whether it is too much of one thing, too little of certain things. And in my opinion, when it's just an imbalance, it's easier to work with you and to balance your hormones out. In my opinion, if this is all that you have and there's really no other issues in terms of there's no tilted uterus or trauma to the uterus or any scarring to the uterus or blocked fallopian tubes, most of the time when I work with them and when we do a detox program and put them on hormone balancing herbs and supplements, their chances of getting pregnant is high. In fact, on some of these patients, they have had a history of miscarriage either at 13 weeks. One patient actually had a miscarriage 6 times prior to seeing me. And once after we did this test on her, and after I analyzed it, I told her, I really don't see why you cannot get pregnant or stay pregnant. And lo and behold, 3 months later, she did get pregnant, and her baby is easily 5 years old now. So thanks for watching, and please don't hesitate to reach out to me for any question. I would love to hear you and listen to your fertility journey, and to give me a chance to help you to become parents. Thank you, and thanks for watching.